range of motion for the lumbar region. So range of motion for the lumbar region, lateral flexion. So coming down, so Hannah, if you can slide your left hand down the outside of your left leg. Having a look how far she can go. And we're going to do a bilateral comparison on the other side. And coming down this side, sliding that right hand down the right leg. And we can see how far the arms come down. That's a very good measurement of our range of motion there. Forward flexion. Charmaine, you might want to get that from the side. So flexion of the lumbar spine has to really come from the lumbar region and not from the hips. So can you demonstrate rolling forward from the lumbar region first, Hannah? So you're going to roll from here and then roll all the way down into the lumbar. Okay, and stopping there. Just coming back up a little bit more. Back up more with your hips. That's it. Okay, so just go down a little bit more with your lumbar region. Okay, and then stop there. So that's the range of motion of the lumbar region. If she goes any further, then she's going to start going into hip range of motion. So come back up. So let's see that again. So range of motion, so flexion of the lumbar region, just going down, rolling and stopping about there. So you may need to stop your client before they go into hip flexion. Extension's just coming back from a position of flexion. If we were to go back this way, that's actually going into hyperextension, and we don't want to do that. If someone's presented to us with lower back pain, putting them into hyperextension is not ideal. There may be something going on in the lumbar spine that we're not aware of that's going to exacerbate that problem. And to do the rotation, we actually need to do that seated. So we'll just walk over to the table. And the rotation for the lumbar region is similar to the thoracic, so just crossing over your arms over your shoulders there, and you're just going to rotate right around as far as you can to the left first. Okay, back to the centre, and then to the right. So this really highlights more of the upper lumbar region coming into the mid-thoracics or the lower thoracics there, rather than down at the lumbar sacral spine. So it's more of the sort of L1, 2, 3, rather than the 4 and the 5. Okay, just pop your arms down. For the resisted, we can do that seated. So you do your active standing except for the rotation, and the rest we can do seated. So seated, flexion and extension, hands across the chest, so around the clavicle there, being mindful not to touch any breast tissue, and the other hand's just around sort of T1 to T2. And you're going to roll forward. That's it. I'm resisting that. Coming back up, I'm resisting the extension on the backward movement. Lateral flexion again is the same, similar to thoracic. So coming down to the left and trying to really do the movement from the waist. Okay, back to the centre and then down to the other side. And back to the centre. And rotation, so coming around this to the right. Okay, back to the centre and to the left. Okay, so that's your active and resisted range of motion for the lumbar region.